Hi, What the Health Tech listeners. I'm your host this week, Jonathan Alsop. This is the podcast where we tackle some of the trending topics, ideas, and best practice in health and social care. This week, I am speaking to Dennis McCarthy, who is a regional assessor at NQA. He's also a world-renowned author, aren't you, Dennis?
Yeah, that's correct.
For those who don't know what NQA does, Dennis, could you just provide our listeners an overview of the services that NQA provide?
Yes, NQA are primarily a certification body, which in terms of ISO, we provide various certification management for various standards. So, for example, ISO 9001, which is quality management, ISO 14001, which is environmental management, ISO 45001, which is health and safety, 22301, business continuity, 27001, which is information security. We do a number of standards.
I was going to say we'll be probably here till dinner time.
We will
if we kept reeling off everything that everything that NQA does.
Yes.
So in terms of information security in ISO 27001, then, so what does that mean? Why is that important in an industry like ours in healthcare?
I think it's important in most industries, even more so now. I think with the threats to cybersecurity as a whole, as an umbrella. I think with the healthcare, with data protection, particularly ISO 27001, is very, very valuable. It makes the information management systems more robust. It makes your cybersecurity more robust, your internal IT a lot more accountable, but at the same time, it makes them very proactive in trying to stop threats coming in. And it's good internal awareness as well, I think. But with the healthcare, with the amount of data and the sensitivity of data that Radar Healthcare may hold with its customers and the health industry as a whole, it's a very valuable tool to have.
Yeah, it is. Like I say, I've been out and done auditing, and it doesn't sometimes get the promotion that it should do. But yes. So in terms of any advice that you could provide our viewers out there, is there any advice that you could provide for those who are looking to go down the certification journey? Yeah,
I think the one word is preparation. I think without a doubt. I think with your certification body like NQA, we see ourselves as more of a partnership. It's a cliche, but that's how well we see ourselves with the clients. So you have initially, I think they need to be prepared for it. They need to make sure that is the correct standard. And by talking to the certification body, the certification body will assist them, telling them which pathway to go down. So if we say ISO 27001 is an example, you go through the process of speaking to our salespeople and our scheduling people to sort of sort out a timescale of when that 27001 can be implemented, and then the preparation behind that. We may help with a gap analysis, and then you have what's called a stage one, which is really seeing how prepared you are for the upcoming audit, and the stage two audit really then is your in-depth audit, which looks at all your systems. And if we take 27001 as an example, we look at various things like your business context, your leadership, your HR, but at the same time, and more importantly, for 27001, your technical controls that are in there as well.
No, so how are you finding organisations adapting to the new 27001 2022 standard? Because obviously we all know that got released last year. And I think there's a 3-year transition period for that.
It is, yes. It's a very good question now, because every company is different. And I've done a number of audits to the new standard, and companies are approaching it differently. But in a way, that shows the benefit of the new standard, because it can be quite individual. So we have companies which are quite high tech in terms of IT and telecoms, who it's a very smooth transition for them. But we have other companies which are maybe just very, very primarily office based, which don't have the IT tech intelligence, let's say, or skill set inside the company. So they outsource it. They've been getting assistance from their third party support. And we rate our healthcare, which, like yourselves, you have internal IT skill sets or technical skill sets, but still use third party support. So they're adapting to it very differently. But I quite like the new standard. I think it's gone from 114 controls down to 93 controls.
Correct.
Which has made it, thank you, which has made it a little bit easier, I think, to manage. But I think there's a very preventive approach to the new standard.
Yeah, especially under the 4 new domains as well, isn't there?
Correct, yeah.
It is a lot more, it's a lot more in its own bracket, it's a bit more bracketed, isn't it, than the 114 separate things that, It
is. It's very prescriptive. I like the way it's very prescriptive, and so companies can adapt it to their activities a little bit easier, I think, than the 2013 standard.
Yeah. How easy are organisations? How easy would it be for an organisation to be certified to 27,000? I know that's quite a difficult question because I know from speaking to organisations in the past, you'd have some say, we've managed to do it in a month. You do see those LinkedIn posts.
Yes.
That go, we've done it in 4 weeks. But you then, on the flip side, see organisations that they've planned and readied themselves for 12 months, 18 months. How long would you say it would take for someone to go through the whole process, start to finish?
Oh my word! How big is the universe? I do think it depends on how committed the organisation is. I think you said like 12 to 18 months. I think that things would be embedded already. You'd have controls embedded already before you would approach looking to get the 27,001 standard. I would say anywhere possibly 6 months from when you start talking to a soft body is probably a good time scale, probably an average time scale maybe. Because again, you have to prepare yourself for a stage 1 audit. And talking to the certification body, I think, does help. They can give you that time scale. The stage 1 is particularly helpful. Sometimes a gap analysis prior to a stage 1 can help. But you need to ready yourself really for the stage 2 audit.
Just picking on something that you said there, I do think it's really important to actually spend time to look at the certification body that is right for you as well, because there is a number of organisations out there that are accredited to certify against certain standards, and there's those that aren't. And I think one of the main problems that I found in the past, organisations not looking into a certification body, jumping the gun, paying a lot of money to then find out later down the line that they weren't UCAS accredited, like NQA. Yeah, I think it's really worthwhile actually, spending that time and performing that research, but to find the right one.
It's a good point because we are accredited to UCAS, and UCAS come and audit us. We get internally audited by UCAS every year. So, and for our clients, that's actually really good. It goes to show that we've got a commitment and we've got a high quality auditing and certification management within NQA. I think the non-UCAS accredited, they may not have that commitment, or they're not required to show that same commitment. And while the cost may be slightly cheaper in long term, and when you're looking to show your clients that you're the benefit of your management system and how will it help them, being with a UCAS accredited certification management company really helps.
Yeah, I think it does really show that commitment, because if you're for our listeners out there, if you're non-UCAS accredited, you can almost write your own rules. And I think that's a big problem out there, that sometimes having that consistency of a UCAS audit, no matter who you go to with, it's the same process, it's the same amount, it should in theory be the same amount of days, the same competent auditor. But when you go for those who aren't UCAS accredited, they can basically write, they throw that rule book out the window and then create their own. So yeah, it does, and I think that's quite key, because it's seen as quite an easy route through to certification to go for a non-UCAS, and a lot of organisations don't understand that sometimes provides very little value for the purposes of why they're wanting to achieve that certification. Okay. So what would you say is the most reassuring thing about going for one of these standards? How does that reassure the wider public?
I think a company that has an ISO standard, whether it be 9014, like quality, environment, health, safety, or information security as examples, it shows that it's taken a commitment to undertake an audit to show the benefits of the management system, both internally and externally, as well as how robust the systems actually are. So in the case of Radar, with the 9001 and 27001, Radar Healthcare do audits once a year, 3-day surveillance. I know this year has been slightly different.
Yeah, we went to the transition. We did it nice and early.
You didn't we? You transitioned to the new standard. But that shows that your commitment to your customers, that you have a robust management system in place, and also that you're willing to open the doors and say, look, come in and audit us. There's a very open approach to Radar Healthcare. And it's very much like when I carry out the audits at Radar, they're very much a very open book. They'll say, well, we've done this and we've done this. We're looking at doing this in the future. Yeah. We're looking at this area in the future, and we're looking to develop this area.
You missed the great compliance team in that. I was very disappointed.
There's a lot of great teams in Radar
but the compliance team is the number one. Sorry, everybody else. I'm a little bit biased. So in terms of, if we just look at Radar Healthcare, have you seen, and our audit, have you seen did you see anything that, really stood out for you?
Yeah, there's a couple of things. When I first, like last year at Radar, again, they did the stage 1 and stage 2 was the first time they were going for it. So it's been, I think Radar are a glutton for punishment to go through getting the standard last year and then transitioning this year. I think you're absolutely crazy, but I'm glad you did it. Yeah. It was really good. I think this year, there's a lot more robustness. Yeah. I think, and it ties into the new standard. There's a lot more preventive approach within Radar Healthcare from last year. So if you take the new standard, things like threat intelligence, web filtering, these things are very preventive. Yeah. And I saw that during the audit this time. Like, for example, you've blocked some sites. Yeah. So part of web filtering, your threat intelligence is quite good. Yeah. Using the National Cybersecurity Center, etc. Your legal register has been good. You've reviewed that. I think that the document review again has been very good, but you've gone through it with almost a fine-tooth comb this time. And I think the one thing I did like is you're always willing to learn. You're always looking for things. Can we do this better? Can we do this better? Yeah. Your support yesterday was outstanding. When I looked at your support tickets, we had a young lad who's only joined the company, I think, a few months back. Yeah, Carbon. Yeah, and not only was he showing me support tickets, he's actually gone back to the customer to say, well, if you do this, this, and this, it prevents you having to contact us. Again, very preventive. Yeah. And again, an efficient process. So I've been quite impressed, I think, this year with the approach.
Yeah, we are quite good. When it comes to, recruitment and things like that, it's all about the culture and, and all about, the type of person that we bring into the role, who can provide those type of services to our customers.
One thing I would say as well, I think the amount of time leadership spend on the audit is really good. I think I spoke to Lee at length yesterday. Yeah. I think so, the COO, and I think it was quite refreshing, the hands-on approach he's got. I know sometimes you've got to shut them up, but that's not a bad thing. Yeah.
And Paul would have also been there had he not been on a big giant bird over the Atlantic, Vegas. Coming back from Vegas. So yes. So how do you find? Because obviously I know Radar, we are venturing out and trying to break the US market. How do you find 27001 over in the States? Because when I previously was an auditor, I found that it wasn't as much out there as what it is over here. They tend to stick more with their American created standards than trying to adopt 27,001. Have you finding that changing?
Yeah, that landscape is definitely changing. I do a number of audits for companies in the States, and primarily they were like, in terms of information security, they're very much SOC led, as we call it, but they're really bridging the 9001 and SOC audits together. They're bringing them, integrating them a little bit more, using, in some cases, the duplication and SOC audits are quite in depth. They go on for a number of months. They're quite particular to the company's activities, but it is changing, more so because a lot of them have partnerships, I think, with companies in Europe, not just the UK. So they're either through acquisitions or through partnerships to get a foothold or get a visibility within Europe. So they're having to look at ISO as a sort of a standard that they need from a global perspective.
Yeah. Okay. So what in your view, and this is where I'm going to allow you to inflate your ego a little bit. So what makes a good assessor? So what makes a good auditor? Because this is always quite an interesting one as well. With when I used to go out and audit, you saw all different types of auditor, some good, some bad, hasten to say. But so what would you feel? What is that? What makes that good auditor?
I think you need to be objective for a start, because well, the standard is the standard. The standard can be implemented in a number of different ways.
It can, yeah.
You need to be very objective of what the company does. It's not a one size fits all, which is what the standard is made for. I think you need to listen to the client. You need to be, I think, approachable. I think that's a very key word. As well as that, in some cases, you need to be a little bit firm. You are there to audit the company. You want to give the best value to that company.
I have the bruises from yesterday.
So you want to give as much value to the company. I always go into every audit thinking, this company should get something out of this audit, which we did yesterday as well. So I do think you're there not only to audit the company, but you're there as well as a representative of NQA. Yeah. So you need to bear that in mind as well.
Yeah, I think just picking up on what you said there, it's very similar to how we work in like the partnership model. That to be that good auditor, I think you have to sit down and listen to the company, because it isn't a one size fits all approach, and that's why the standard is sometimes overly light in certain areas, because it allows you to then fit that to the model of your company, and then allow you to then evidence that, when your friendly auditor comes out and sits down and looks through.
I think you're right, and I think companies use the experience of the auditor to get that best practice. Particularly, like we spoke yesterday about the innovation, I think, side of things, and my experience within that in some of the areas that we were talking about at that time really helped me shape what you guys were doing, but also helped thinking, that is trend management and etc. So it is very much a two-way street.
Because a lot of people don't realise that in business and in life, not every day do you get someone out into your office that has seen, goes out into multiple industries, multiple organisations, and gets to see how things have been implemented so many times. Because when you're a bit isolated when you're actually implementing at a company, because you only know your way, whereas an auditor might know, 10, 20, 30 different ways that that you could look to adapt within the company. Obviously, without providing advice.
Obviously, no, we're not allowed to consult, but we do offer best practice. But maybe you're isolated because everybody's avoiding you, Jonathan.
Yeah, well, don't say that. Don't say that. Yes, and just picking back onto one of your earlier points when you say about we were a bit of a glutton for punishment. I didn't grey hairs. We are certainly glutton for punishment. We achieved, but I think it worked well. We achieved like 9,001 and 27,001 within 9 months along the journey. Do you find that people go for Cyber Essentials quite quickly after 27,001? Because we certainly did that. I think we achieved basic Cyber Essentials 2 days after our stage 2 days after our stage 2 audit, 27,001 and 9,001, that's when we achieved our basic cyber essentials and then went plus in March. So yes, certainly glutton for punishment. Do you find many organisations adapting that?
I think those that are very much technology led tend to have either cyber essentials plus prior to getting 27,001 as an example. The reason they are different, again, 27,001 is very much a rounded management system. It involves everybody, includes everybody within the company. Whereas your Cyber Essentials Plus is very much led to your weaknesses within your vulnerability within the network, etc. So I think in my experience, I found that technology companies tend to have them be prior to have some form of it prior to going for 27,001. Non-technology companies tend to get it afterwards. Yeah, I think when they see, we can add that to our 27,001
with that one.
You possibly have,
yeah. It does. To be fair, it does make sense because if you go for Cyber Essentials, it almost sets you up for that more intense kind of assessment process, because it is intense. I'm not going to say one's better than the other. They're there to suit a purpose, but it certainly does set you up for that more intense type of audit. At the end of each episode, we ask everyone to describe their what the HealthTech moment. We want to hear your weird and wonderful stories and what you've experienced in the health and social care industry. I would like to direct the above question to Dennis, and it doesn't necessarily have to be about health, but do you have any interesting stories during your time as being an auditor? About auditing. Let's put it down to audit. I know you're.
None I could possibly say.
I was going to say, this podcast is PG. I'll just put that out there. Mind you, I did tell my funny audit story on my last podcast, and I regretted it, and probably still do. So, yes, have you got any funny audit stories?
Oh, just too many. We'll be here all day.
Oh, go on.
We really would. I remember very early on, probably more of a funny one for me. I went into a company and we were in a shared building, and been auditor for lead auditor for 8 years now. And I went into a company and sat down, met the manager, spoke to the manager, and then the compliance person came in, and I was in completely the wrong company. I should have been up on the first floor, and I was on the ground floor.
You know what?
That was quite funny.
Yeah.
I've gone into a company that the compliance manager went on holiday because he thought the audit was the following month, and he went on holiday. Whether that was deliberate or not, I'm not so sure. I've accidentally been locked in the server room. I say accidentally. I was accidentally locked in the server room for a couple of hours. That was maybe not a couple of hours, a couple of minutes. That was quite funny.
I'll just put out there. You are an intelligent auditor, though. Just for those viewers listening to these stories. But I must admit that one certainly about going to the wrong company. That has happened to me. I actually ended up at ironically our hosting provider. When I was, I ended up at Red Centric when I was to audit a company, and I was actually only 2 minutes. I should have been 2 minutes around the corner from my house. So then I had another 45-minute journey back over there. So yes, I was late for that.
I didn't know that much. It was a ground floor and first floor.
Yeah, so happens to us all.
The signage was very poor. It was very poor.
Is that your excuse?
Yeah, that's the excuse.
Right, I think we've covered everything, Dennis. Thank you for joining us this week, and thanks to everyone who is listening to the podcast. We'll have another brand new episode out in a couple of weeks. Don't forget to rate and subscribe, and if you have any questions, please don't hesitate to email whatthehealthtech@radarhealthcare.com. Thank you, Dennis.
You're welcome.